Gynecology is a field of medicine that deals with the care of female reproductive health, while andrology deals with male reproductive health. Is reproductive health so important that separate branches of medicine are needed to deal with this aspect of health? Let's understand what we mean by reproductive health. The World Health Organization, WHO, defines reproductive health as total well-being in physical, emotional, behavioral, and social aspects of reproduction. Good reproductive health implies that people have the capability to reproduce and have the freedom to decide when and how often to do so. A reproductively healthy society is aware of and has access to safe and effective birth control methods. It is also provided with appropriate healthcare services that cater to the problems associated with the reproductive system. Good reproductive health also means that women undergo safe pregnancy and are given proper pre- and postnatal care. The field of medicine that deals with the care of women during pregnancy, childbirth, and the post-delivery recovery period is called obstetrics. Many problems beset the path towards the goal of a reproductively healthy society. Pregnancy at an early age is a problem that can pose health risks to both the mother and her child. Both physical and emotional maturity are necessary for childbearing. Hence, the Indian government has fixed the marriageable age for women as 18 years and for men as 21 years. It is advised that there should be a gap of at least 2 years between two pregnancies. Women can die owing to complications during pregnancy and childbirth. According to WHO estimates, 3,58,000 women die every year from complications during pregnancy and childbirth. Pregnancy-related deaths can be avoided by providing all sections of the country with access to quality health care. Creating social awareness of reproduction-related matters via the audiovisual and print media is also helpful. Sex education should be introduced in schools, as it will mean correct and age-appropriate information is provided to the children. This will help clear misconceptions about sex-related issues from children's minds. Children should be made aware of the changes in the reproductive system that occur during adolescence. Society should be educated about safe and hygienic sexual practices in order to avoid sexually transmitted diseases, STDs. Creating AIDS awareness is necessary to prevent people from engaging in unsafe sexual practices. Young people in the marriageable age group should be educated about birth control options. Awareness of the problems of population explosion, as well as social evils such as sex abuse and sex-related crimes, needs to be created. The Indian government has initiated various action plans in order to achieve its goal of total reproductive health. The Indian government's Ministry of Health and Family Welfare is responsible for the family planning programs. An inverted red triangle is the symbol for family planning products and services in India. The Indian government was the first in the world to initiate a nationwide family planning program. This was in the year 1951. The Reproductive and Child Health RCH program, launched in 1997, aimed at building a reproductively healthy society by providing quality healthcare services. Reproductive research is encouraged in India. scientists at the Central Drug Research Institute, CDRI, in Lucknow developed Saheli, a female oral contraceptive. A statutory ban on amniocentesis as a sex determination technique was implemented to check female feticides. In amniocentesis, the amniotic fluid is examined to study the chromosome pattern of the fetus. The sex of the fetus can be detected by this method. Not only India, but reproductive health is an issue concerning the entire world. However, successful implementation of these various action plans requires infrastructural facilities, dedicated and trained professionals, and the support of the general public.